Welcome to Health Live at Seniors Today. Through the year, we have a variety of sessions, and one of the topics that we do look at on a regular basis is care for the eyes. And we invite many senior ophthalmologists and eye specialists, that is, to take sessions. And today we have invited from Mumbai, Dr. Rupal Rathod, who's a senior ophthalmologist, to talk about age-related macular degeneration, that is AMD, presbyopia, and dry eyes. Before I invite her and welcome her, let me give a short introduction to Dr. Rathod. Dr. Rupal Rathod is senior ophthalmologist at the OJAS Maxivision Super Speciality Hospital in Mumbai. After completing her MBBS and an internship from the Grant Medical College and the JJ Group of Hospitals in Mumbai, she did her DOMS, which is in ophthalmology, from the Lotus High Hospital in Juhu in Mumbai, and she then pursued her DNB in ophthalmology at the Lotus High Hospital in Navi Mumbai in 2008. She was then sent. She then went for observership in clinical and surgical ophthalmology at Atlanta, Georgia, in the USA, and she has gained expertise in dealing with all types of ocular conditions in anterior and posterior segment. She is proficient at performing a variety of surgeries like cataract, with expertise in implanting premium advanced surgeries, and with management of dry eyes and glaucoma, as well as performing anterior segment laser procedures for various ocular conditions. Welcome to Health Live at Seniors Today, Dr. Rupal Rathod. How are you?
Thank you so much, sir, for giving me such a nice introduction. First of all, very good evening to everyone. Just again, a brief introduction about myself. Myself, Dr. Rupal Rathod. As first said, I am just attached as a senior consultant at OJAS Maxivision, Mumbai at Bandra. We have two branches at Bandra and one at Kandivali East. So here I am going to talk on some few topics which are related to our senior citizen, basically just to educate them and let them know that how the comprehensive eye examination is very much required in their ages. So can we just start, sir, with the presentation?
Yeah, over to you. So as always, do remember that sessions like these are advisory in nature. Yes, I must mention also here that this session is being recorded on September 6th, 2025. So if you are watching this 2 years later, do remember that this some developments may have taken place. So do refer to Dr. Rupal Rathod or anywhere else for an update in terms of medical technology. Also note that this is an advisory in nature session, and if you do have a condition which requires attention, so you must meet a medical practitioner and in the area of ophthalmology for a checkup. As always, this session is being recorded and it will be up on the website, on the Seniors Today website, on Monday evening, so you can look at that. Don't need to take down notes just now, and ask your questions, post your questions after the presentation is over. And doctor is going to make a presentation for around 15 odd minutes, so do listen in, do watch carefully, and then you can ask questions. Over to you, Dr. Rathod.
Yeah, thank you so much. With a lot of picture presentation so that our senior citizens are able to understand everything very smoothly.
Yeah.
So first topic which we are going to cover for all our senior citizens will be, the condition is called age-related macular degeneration. What is this, how it is, what should be the treatment, what should be the observation, what should be the management, will cover step by step during this presentation. So we'll start with the basics. Okay, what is the basic? What is vision? What is the normal eye? What is normal macula? So your eye has a part inside, besides your lens and cornea. It's called retina, and very center part of the retina is called macula. Okay, which is responsible for your sharp and central vision. It's like a camera sensor of your eye. It's also called a reading spot of your eye. Okay, if you see here, I have actually marked what is macula. Okay, our disease which we are going to discuss about is all related to this reading spot or the camera sensor of your eye. So here I'm just presenting you first of all to let you people know how your inside of your eye looks like, how the camera sensor of your eye looks like. It's a small red dot very much in the center of both of your eye. This is a picture of both of your eye. So in the black and white picture, we have the scan results of the sensor area of the eye, which is we call as macula. So it looks like a small dip uh, after this the flat area. So this dip is the actually the macular area. It's also called the very much center is called as fovea. I hope you guys are able to understand me. I'm just talking you about whether what's the first of all what is the normal thing inside the eye. So coming to our condition, what we are going to discuss today, it's called age-related macular degeneration. Now, first of all, the term itself is very explanatory. It is giving you idea that this condition is age-related. It comes along with the aging process. Now, where it affects the macula. Right now, I have just shown you previous slides about what the macula is. The macula is the sensor part of your eye, camera, and the very much reading spot of your eye. So this disease, it's definitely it is damaging or causing degeneration of this part of your eye. So it is defined as an age-related condition that causes gradual damage of the macula. So what, because this disease is related to only macula and macula is responsible only for the central vision, your peripheral vision or what we say is the side vision is never affected. So the person doesn't go into total blindness. Okay, so you are not supposed to get scared of this disease that it will cause you complete blindness. So coming to more details of this disease, so this because it's a degenerative disease, it has stages of the disease. So the first type is called as a dry AMD, and the second one is called as a wet AMD. Now, what is dry AMD? So you will be able to see the pictures I have put by the side. One is the normal eye. Okay, besides the you can see a optic nerve over there, and from there the blood vessels are coming, and the very center point is called macula. The same macular area in the second picture is showing some yellowish point dot like structures. Okay, this is called as this happens in dry AMD. Some yellow spots starts coming at your macula, at your camera sensor point. Okay, around it there are this deposits which starts coming up, and if the disease progresses further, you start getting, blood and abnormal blood vessels or some spots of large blood over there. So that is the last picture. So, what is dry AMD? Now, most common degeneration in the aging people is this dry AMD. Now, this dry AMD, it causes more of thinning of your macula. It also causes deposits or yellow-white deposits in this area. This deposits in medical term is called drusens. It starts getting deposits beneath your retina, and this causes gradual, because there is something coming in your way of your vision, gradual vision loss happens. It is a very slow process because anyways it's a degenerative process. So you with aging it, you don't start losing your vision as soon as possible as the disease starts. Okay, it's a very gradual disease. You can still halt this disease. Now, the other part of the disease, which I said, if it progresses more further, it goes into a condition which is called as wet AMD. So, what happens in the same macular area where we had got only yellow-white deposits, if it progresses rapidly or it progresses in an abnormal way, it starts developing some minute leaky blood vessels beneath the retina. These blood vessels are not normal as your other part of the retina, and it may, leak the blood from inside. Okay, this may hamper your vision very drastically, causing you more of severe vision loss. So the progression, if it is happened, has to be treated on urgent basis with the newest technology we have. We'll discuss it on later. So hope this picture, which I have put with this slide, you are able to understand. So in the previous pictures where you had seen the normal eye, how it looks from inside, it was all very clear. But in this picture, you can see there's a lot of blood. But it's a very hazy picture. There's a lot of yellowish deposits, and definitely even the picture is not so clear. So it does indicates that there are some abnormal blood vessels which has grown in the area of macula. So just to make you understand in a more better way in how your vision will be affected, I have just put a picture of tree. The very first picture on your left hand side shows that a tree is very clearly seen with a normal eye. Okay, in dry stage of your disease, where only yellow deposits come around the macula, you can see that same tree is seen, but it is a little bit hazy. So this is called a fuzzy vision or a distorted vision. The tree is a little bit, fuzzy also, and a little bit changed in overall structure of the tree. If the disease progresses to what we call as wet ARMD, definitely the central vision is grossly affected. You are not able to recognize the tree that well. You are able to just see the outside part of the tree. Okay, this is how the vision loss progresses if the disease progresses from mild form, which is dry ARMD, to an abnormal disease, to an advanced disease, which is called wet ARMD. So what are the risk factors? Does everyone get this disease as people age? No, it doesn't. Okay, there are few risk factors. We'll just discuss it about it one by one. So first, very much risk factor is the age. It does happen about the age of 75. Another risk factor is genetics. Not every people all the people about 75 will get the disease. There is something called genetic predisposition also. This disease does run in generations. Pre-generation, if you have any family history, you are likely to have, chances of getting this disease in your late 75s, 80s. Another is your lifestyle. Okay, if you're heavily smoking in your early days and all those things, this does predispose you to having those disease. Another is poor diet. Okay, as our generation is progressing, you know that a diet is not so good. Low intake of fruits, vegetables, or omega-3 fatty acid does carry high risk of getting this disease in the age of 75 and more. Another thing is obesity. Definitely, obesity is not good for any kind of disease. So is with this disease also. So what should you look after in the symptoms of this disease? How will you recognize? Okay, you will start getting symptoms of blurry vision, fuzzy vision. Sometimes when you're looking at your books, the line books, you might feel that the lines are really wavy. It is not the straight lines. Yeah, there are distorted lines which are able to see. Another is, dark or empty spots. When I'm looking somewhere, you will suddenly see that, I'm not able to recognize the center part of the face. It's called the blind spot. Okay, you're not completely, if you're looking at a person, that person's eyes, face, nose is not seen, but, hair and everything is seen. So the central, dark spots they develop. Another is what happens next in the symptom is loss of color vibrancy. Okay, the normal color contrast which you used to recognize it very bright and everything, the color feels very much dull. You are not able to differentiate between the shades of your color. So these are all the symptoms related to disease. First is blurred vision, waviness of the vision, dark spots in front of your eye, or the color starts fading off. Please keep all the symptoms in the mind, and if you have any such symptoms coming up in your eye, just have a checkup with ophthalmologist nearby. So this is a picture where I am actually able to let you know what is normal vision, what is the vision with degeneration in the early part, and then in the late stage. Now, in the normal vision, you can see a girl is hugging her mom. All the colors on her t-shirts are very much brightly seen. Her face is so clear. But as in as the disease progresses or you start having the disease, the face, you are able to see everything, but it's very fuzzy. So this is the early stage of the disease. Okay, the colors are not so much bright. And with the late stage of the disease, the central vision starts affecting. Okay, and obviously the whole of the picture is not so much clear. So this is what happens as your disease progresses, and it's a very gradual disease. It won't happen over just 2-3 months. You have to keep on check of the symptoms every month once by yourself. So again, the same picture I have put of the tree below. So for very first picture is of a tree where disease have just started. So you're able to see tree from far off very well. Again, when the disease starts progressing, the center part of the picture becomes hazy. As in as it progresses, it feels like the center part I'm not able to see at all. So when you visit the ophthalmologist, we usually do a scan of your eye, the scan of your macula of the eye. So very first, the black and white picture on the top shows the normal eye with the normal macula. Okay, the second picture is showing some kind of waviness in your black and white scan. If you can recognize towards the lower portion, in the black and white scan. And in the very third part, it's very evident. Everything is distorted. The shape is not there of the normal eye and the macula of the eye. So this is what is expected if the disease is progressing and what we diagnose with. So how should we go about with the disease? Now that you have come to know about the symptoms, okay, what's happening with your eye, what's happening with the vision, just an ophthalmologist should be visited immediately. What he will do next is he will have a dilated eye examination done for you, wherein the doctor will definitely check the inside of your eye with thorough details. Okay, so and first is the visit to the any of the ophthalmologist. Second is you can monitor itself whether you are having this disease by something called as Emsler grid. Now, I'll just have a picture about what is this Emsler grid. It is just a paper with lots of small squares. And you have to just monitor the waviness if you observe on this paper when you look at the paper. Okay, that's called an Emsler grid. And third test, which is usually recommended for all about the age of 50s, 60s, and even 70s, is a scan which is called as OCT scan, which takes a detailed image of your retina, especially the macular area. So this is what I was telling about the Emsler grid. So on your left hand side, as you can see, this paper is made up of many tiny squares, very adjacent to each other. And if you look with one eye closed, you should be able to see each of the squares with each of the lines very much clearly seen in a straight way. But if you have this disease, when you close the eye, which is the affected eye, you will see that the squares are not the square anymore. They are distorted, or there is a blind spot, or there is a black spot. You are not able to recognize in one particular area. So this is the way you can keep this paper at home, get it printed out, and you can just check your eyes, in a month once, close one eye, have a look at this paper. If there is any waviness, not so normal line seen, then you should immediately go and see an ophthalmologist. So coming to this treatment, so now we have known that what is the normal eye, what is the abnormal eye, what is this disease, what are the stages of disease, what happens to you. So we should be now coming about the treatment part. After the ophthalmologist you have seen, he will diagnose you with the required condition, whether you have a dry RMD or a wet RMD. So dry RMD as such is a very slow progressive disease. It won't hamper your vision till a long time if you're kept under good monitoring your, we can salvage your vision. There is no progression of that. We can just keep a check on it. So dry RMD usually doesn't have any treatment because it's just a degeneration. It's not a disease yet completely. So we can start you and some antioxidants, on some supplements which are good for your eye, which can slow the progression of this disease. Another disease, if the disease has progressed to such an extent that it has become a wet ARMD wherein there is a lot of bleed inside, then definitely there are some newer injections, newer molecules which have been come, and we have to go give you this injection inside your eye to stabilize your vision and remove all those bloods and abnormal blood vessels from your eye, from the area of macula, and plus supplemented with a healthy diet. Definitely this disease is treatable, and we can salvage your vision. We can prevent the vision loss. I hope you had a good information about this disease, especially to our all senior citizens. It is must to know that why, because of all such disease existing in newer age, it's very important to visit for any ophthalmologist for a general eye checkup, because only on general eye checkup you will be able to diagnose this disease, that you have this disease. And our center, OJS Maxivision, we have a lot of expert surgeons and doctors who are available all time for treating and diagnosis this disease. So, if the disease has extended to such an extent that even after treating with injections, there is some kind of vision loss, we can still help out people to have a fairly good vision by using some low vision aid. Okay, what are these low vision aids? These are called aids. Why? Because they are just going to help you to enhance whatever the vision you have. So these are like magnifiers, special type of lenses, or electronic devices which we recommend to use, so that whatever the vision is left after the progressive disease treatment, you are able to at least do your daily work very smoothly. Another recommended things are like have lifestyle changes, stop smoking, have healthy diet. All these things do add to salvage your vision if the disease is progressive to such an extent that even after treatment, your vision has got affected. So this aids, and the lifestyle changes definitely will salvage your vision. It won't hamper your daily life. So, in conclusion, what should be the summary of this whole presentation? It is early diagnosis, early detection, and the management. And we always encourage and our all senior citizens to be very proactive about their high health, and not to hesitate to ask any question related to the disease to any ophthalmologist to visit. Okay, if they have any doubt related to their to eye examination. So definitely a comprehensive eye examination every 6 months or once in a year is recommended. And we at OJAS are doing our best and to salvage the vision of all our senior citizens. Just a small practical advice to all the seniors who are listening to my this presentation today. Whatever age you are, just keep use a good lighting condition at your home. Use brighter lights, especially while doing any task like reading, cooking. Okay. Another is use of technology should be reduced, like smartphone, computers, and tabs. Have an active life and social interactions. Move out of your house. Maintain the physical and social activity. Okay, and rest is talk to your friends, talk to your family, and talk to your doctors regarding your vision, and we are always there for you. Thank you so much. So we have just finished with one of our topics of age-related degeneration of the eye. We'll now move to a very common condition which we all face, is which is called presbyopia. Means getting near numbers as soon you step into your 40s. I'm sure everyone has faced this if you're above 40s. So, what is presbyopia? It is a natural age-related loss of your eye's ability to focus on the close-up objects. And this is actually nothing but just an aging process, nothing else. Okay, what are the symptoms? What happens to you? is you are having difficulty in focusing on the near objects, especially while reading, writing, or signing any checks. It becomes difficult without the numbers, without the glasses. Needing to hold the reading material very close to your eye. You feel blurred vision at all the time if you take up, even a newspaper to read. Third is eye strain and headaches. And if you are having this blurred vision for a long time and you are not getting it treated by wearing the closer lenses, the newer lenses, then it might cause a lot of eye strain and headaches, especially when you start doing your newer work of reading or any kind of close work. You also feel fatigue in and around the eye. There's a lot of tiredness in and around the eye when you start doing your newer work. Okay, and needing a more brighter source of the light. This is also one of the symptoms. So this is just an understanding. This picture is just showing an understanding that with the normal vision, there is a light in yellow. It's in the form of the yellow arrow, which is going and hitting your retina. But with presbyopia, the same light which is going inside is not able to hit the retina, and that's why the near objects becomes fairly blurred. Okay, what is the treatment of this presbyopia? चाली सी लगी है ऐसे बोलते हैं. So the thing is, the treatment part of this condition, which is again a aging process, is just start using the near glasses. Get it checked by an ophthalmologist nearby and start using those numbers as in when you require for your near work. There are also contact lenses nowadays, specially designed. If people who are very much conscious about reading, using a reading glasses, they can still go ahead with using some contact lenses, wherein they are always involved with the near kind of work, so that no one, they are also very much comfortable, and the glasses are not required to be carried all the time. And if at all they want to get rid of this numbers completely, permanently, then we have also got some refractive surgeries where the surgery is done to remove all those numbers, where the lenses are implanted inside the eye, which carries all your numbers for distance and near and intermediate distance. So you are totally rid of all the numbers. So this is just a picture to let you know the near glasses which we usually start with in around the 40s are available in two forms. The lower one is very commonly used till date. It was called bifocal lenses, where you can see the lower part and there is a small moon-shaped glass, very much separate from the upper glass, which is used to see only for the near objects. And the upper glass, it's a new age lenses which are called as progressive lenses in your glasses. It doesn't have any moon shaped separate glass for looking for the near. All the numbers are incorporated in the same glass from up to down, such a way that you don't have to look only from that small area lower down in your glasses. It is more recommended and it is more user friendly also. So I hope all of you have agreed that you have gone through the usage of all these glasses, especially immediately after your 40s. Coming to another condition, which is the last condition today I'm going to cover, and all of the aging seniors must be facing these things. It's called dry eye. What happens in dry eye? Okay, it's a condition where eye doesn't produce enough tears, or the tears evaporate very quickly, leading to discomfort, burning sensation, redness, and the blood vision. So, just to let you know, on the surface of your eye, we have a layer of tear film. The layer of, in general, what I can, in a layman term, it's a panika layer. Okay, there is a small layer. So it makes your eye to work very smoothly when you blink. We are usually blinking very subconsciously, and it happens very smoothly. It's because of this tear film layer. With aging, with your progressing age, this tear film layer starts becoming thinner and thinner. It becomes thin and it may evaporate also depending upon the AC or the conditions where you stay. And this causes more of burning sensation, redness, and blurred vision. So what are the causes? As we discussed, it's a very common, it's very commonly seen in aging people, like all the senior citizens must be having some kind of dryness. Another thing is environment. Nowadays, we are not living in that good environment. Even the pollution does affect smoke, dry wind, dry air, AC use. All this does affect the tear film layer and it causes dryness. Lifestyle changes, like we are all the time on the screen nowadays, so we are not able to blink that frequently what is required. So that's why the tear film, the layer starts becoming thinner and thinner, causing the dry eye. There are other medical condition also and hormonal changes also which does contribute about to this disease. So what are the remedies to cure it or to prevent it? Okay. First is very much the use of artificial tears. There are a lot of eye drops or the cooling eye drop, as we say in general, or the lubricating eye drops or the moisturizing eye drops. These are the terms used for these drops. Have a regular use of these drops in both your eyes. If you face any of these symptoms of dryness or blurriness or burning sensation in your eye. Okay, apply warm compresses. Okay, a warm wet cloth applied to the eyes can help your oil glands around the eye to make it work better and retain the thickness of your tear film. Increase the humidity. Second, another thing is blink often. Okay, if you're a laptop gadget user, they are always constantly on the laptop and they're not able to blink. They feel that we can miss something from the screen, so they don't put an effort to blink. So the blinking rate decreases. So in between, blink often if you people are more of on the gadgets, on the laptops, on the computer screen. Okay, and definitely avoid smoking and and the dry wind areas. So this was the very first disease which we discussed was definitely a topic which was required to be discussed with all our aging senior citizens. Definitely have a detailed eye examination on routine checkup done. We are at OJAS and we are always there to help you out. Thank you so much.
Thank you very much. Thank you very much, Dr. Rupal Rathod, for being for a very detailed presentation. Uh, yeah, so we have quite a few questions that have come in already. I'm going to just take a few of them. Um, so this is from Mr. Jamunathan, who is 77. He's from Bangalore. His question is it that all people, all seniors go through AMD?
No, can I answer now?
Yes, please go ahead.
Yeah, as I mentioned in my presentation, all senior citizen doesn't carry this disease, but yeah, definitely there is a genetic predisposition also, which plays a major role. Not all of them will get heart attack. If you have seen, if you have listened, if you know this, okay. So don't worry about this. That if you're senior citizen above 60 or 70, you will get this. Just have a routine checkup done. Nothing else.
Right. A question from Mr. Anil Singh. What are the best vitamins for dry eyes and AMD? Any vitamin that
Yes,
you
sir.
would recommend? Meena Goyal
Yeah.
also asks.
Yeah. So normally vitamin A in a natural form is best for everyone, but coming with the new advances and with this diseases coming up, definitely visit an ophthalmologist and they will recommend you the required antioxidants and supplements for you and for your eye.
Right. There's a question from G. Chandrasekharan for his. He's asking for his wife who has had these conditions. Will high myopia and medicines taken for TB treatment like thimerosal, uh, ethambutol lead to AMD?
No, sir. This condition that doesn't lead to AMD. Myopia with all these changes and with TB medication is a completely different scenario, different disease. So it is not that it will cause AMD. Just have a detailed, comprehensive examination of your retina and everything done with an ophthalmology, and the ophthalmologist will be able to guide you.
Right. Anupama Singh asks, as you said, lens are implanted to correct vision. In this case, as a person grows older, uh, the lens may be required to change. So how is that taken care of?
It's the lens which are implanted are pretty much permanent in nature. It doesn't require any explantation or any removal in the later date. It has been customized as per your eye and it's been implanted permanently. So that your vision is fairly clear lifelong.
Right. Thank you. Um, a question from Shamla Ravi: is there any way to arrest progression of AMD in the elderly? Can you?
Uh, yeah, we can prevent by, as one of my slides said, there should be good lifestyle changes, avoid smoking, avoid outside food, have healthy diet, have physical activities. All these are small factor, but they do prevent lot of diseases, including AMD.
Right. In fact, Katie Dadanji asked the question, Doctor, are there any tablets to keep, get to keep degeneration away? How do we? Yeah, are there any medicines that one can take?
Okay. It's not always that you should take a medicine to avoid any degenerative changes in your eye. I would rather suggest just keep a check on your eye health every 6 months if you're above 50s and 60s to just at least diagnose if you have this condition existing or not.
Right. Um, and how do we know? Again, a question from Katie Dadanji: how do we know if we have started with cataract?
It's very easy. First of all, you will have the symptoms of blurry vision. You are not happy with glasses. You keep on changing your glasses. And very last thing is visit an ophthalmologist.
Um, this is a question about dry eyes. Is it a permanent disease, or how long do dry eyes last? This is Anupama Singh who asks about this, and also Anil Singh asks, can dry eyes cause vision problems?
Dry eye as such is not a permanent disease. It does have vary in severity from mild, moderate to severe, depending upon your lifestyle also and your in general eye health and your environment also. But yeah, if it is associated with any kind of systemic disease, like there are some diseases like in thyroid people, they do have some dry eye in a more severe form compared to the routine people who are always exposed on the screens. Okay, so I definitely you have treatments going on, and there are available eye drops which will prevent your dryness from progressing.
Right. This is the question from Archana Gupta who asks, is in the rainy season I feel irritation in my eyes. Doctor, is this an allergy that I should do something about?
Yeah, very first thing is if it is really much irritating, you should visit an ophthalmologist just to rule out it's not only a simple dry eye. If there is some allergy condition really going ahead in your eye, then you can just get it treated by an ophthalmologist.
Right. A question from Hina Mehta who asks, after cataract, does the eye vision, the glass number, does it change?
No, after cataract surgery, usually the glass number which are remnant, it doesn't change.
Right. Doctor, any exercises that you would recommend for people to have, you know, for seniors to do for their eyes? Is there anything that you would recommend?
Best exercise, I would say, just have your eyeball rotate up, down, right, left, clockwise and anti-clockwise, and try to avoid mobiles because I have seen a lot of senior citizens, they become homebound, especially in the rainy seasons, and they are all time on the mobile, all time on the, not even the TVs. So start avoiding your mobiles and have go out, have a friend circle, have some physical activity. And best exercise I've told you, just 3 times to 4 times in a day, move your eyeball up, down, right, left, clockwise, anti-clockwise, and look far ahead.
And
Eyes are made to look far off.
does splashing of the eyes with water, does that help?
Not really, not much. You should actually avoid hard splashing of water on your eye because sometimes some senior citizens do it really rigorously, which may damage the surface of your eye, which is called cornea also. And nowadays, anyways, the water content has a lot of chlorine, so better avoid it.
Doctor, you just spoke about mobile phones and avoiding using mobile phones. But the fact of the matter is that people are, in fact, to an extent, mobile phones are also helpful in keeping oneself, uh,
Updated.
busy and not getting bored in their senior citizen in their seniorhood. So, is there assuming that one is accessing the mobile, is there some advice that you would like to give to our seniors, to the audience which is gathered here? We have around 250, 40 people who have gathered here today. Is there something that you would advise people to do?
So, why first the question is why they are on mobile? Because they don't have any other activities. So find and search some activities. Okay, call up your friends, go out, move out, and if they need to use some gadgets, better watch a television, which is far off compared to mobiles.
Right. I guess that's clearly the best thing. I hope people are able to do that. Thank you very much, Dr. Rupal Rathod, for being here. I know it's an immersion Ganpati immersion day in Mumbai, and I'm sure there's a fair amount of festivity around you. So do uh, drive back safely and with all the rush that is there. And thank you everyone for being here. We will be back once again next Saturday at 5 p.m. for another session of Health Live. Before you all leave, I have a few announcements to make. One is that, other than the Health Live session that we have every Saturday at 5 p.m., there's the Evergreen Club, and there are a host of events that happen as part of that. There's the Seniors Today magazine, which will be, the next issue will be out on September 15th, but the website is updated every day, Monday through Saturday, so you can access that. Check out our newsletter, which is sent out at 6 a.m. Every day, so you can update yourself with all new happenings. There are some of you who are regulars with us will know that on September 17th, our 19th season of Seniors Have Talent is starting. Doctor, you'll be happy to know that we have a special event, contest, a talent hunt, if I might say, for senior citizens above the age of 60. And it is called Seniors Have Talent, which is a singing contest. And it's on this 19th season is going to start now. So we've had 18 seasons so far for the last 5 years. And, even if I say it myself, that has been amazing feats. And we have a host of activities through the day. We are starting 2 certificate courses. One on 21st, which is a certificate course in mobile photography. That's a 5-part, 5-session certificate course. It's going to be done by a professional photographer and a teacher in photography. And there's also going to be a certificate course in karaoke singing, which starts from 25th of September. So those of you, do keep in touch with Seniors Today, the Seniors Today team. If you do not know how to get in touch with us, just email us at events@seniorstoday.in. Remember, events@seniorstoday.in, and we will, our team will let you know about these courses that are starting, and of course, anything else that you want to know. Thank you very much once again, Dr. Rupal Rathod, and thank you to the team at Maxivision for facilitating this. Have a great eyesight. Do remember, these sessions are advisory in nature, and if you do have an eye condition that you want attended, go to the nearest ophthalmologist, not just an optician, not just places where you get your eyes, where you get your spectacles. Go to an ophthalmologist and then correct yourself. Doctor, I need to ask you a question which I've just got from one of our regulars.
Yeah,
So I
sure.
just asked this question. This is from Sunita Verma, and I specifically asked because I think it's a little different. After cataract surgery, she asks, I don't feel like earlier. What could be the reason?
In what way?
I am not
So,
very sure, but I guess eyesight and comfort, etc. Is perhaps that's
okay,
what.
if you feel very much different from the previous vision, just have a checkup with your operating surgeon or the ophthalmologist nearby. That's what I can answer, unless I know the details of what kind of feeling you have.
Right. Sunita ji, you are in Baroda, so you can I'm sure in Baroda there are quite a few good ophthalmologists. So please go ahead and refer to them. But thank you once again, Dr. Rupal Rathod, for being here.
If you're in Mumbai, you can always visit us at OJS Maxivision. We are happy to help you out in all the ways.
Right.
We have a Kandivali branch too. If you're coming to anywhere in this area, you can just visit us anytime.
Right. Okay. Thank you very much. Thank you once again. Bye-bye.
Thank you so much.
Subscribe now and press the bell icon. Never miss an update.